Directorate and Local Directorate. We have our Academic Capacity and Development Fund that Rona leads on, and in that you've already heard from PhD students, and you'll hear from many more of the people across our pathway over the next 2 days. We've got some funding for emergent public health priorities, so things coming down the track which needs some work done urgently, and we're retaining funding for that, and you'll hear from some of those as well later over the next few days. And also we had some additional fundings to do some areas for research innovation, and you'll hear something about that too. So we organise our work in this way, and you're going to be hearing from each of these 4 programmes over this afternoon and into tomorrow. So first up will be Healthy Places, Healthy Planet, and then we'll be hearing from the other programmes over this afternoon and the rest of the conference. And these are interconnected programmes and allow us to sort of organise our work, but there's much crossover between those, and many of you will be working on projects, particularly between children, young people and families, and public mental health that cut across all of that. The Emergent Public Health Priorities funding was something that we retained within the budget, because once we start the programmes and we start to commit our funding, if there are new opportunities around perhaps new policies that come into place and natural experiments and things where we might be able to collect initial data or do some work around new policies, if we've committed all of our money, then we're not able to do that. So we've retained some of our budget for these emergent public health priorities. And these are some of the projects that we have already funded within that. So you can see quite topical areas around ultra-processed food, the cities of sanctuary, the impact of 2-child limit on child benefit, and the new policy around vaping that's coming in. So these are new. The final one hasn't started yet, but has just been approved. So you're going to hear some lightning talks from the people doing those emergent public health priority projects tomorrow. Within the areas of research innovation, we've funded 3 areas, and there's sort of 2 within one. So there's a project around data linkage, and you're going to hear from that programme. And then we've also got within that data linkage quantitative data and innovation, but a new programme that's becoming on board around qualitative data and sort of innovation within qualitative data. And then the other 2, which you're not going to hear about because we're only here for 2 days, as the local authority public health finance and innovation in involvement. So we've got the presentation of AfRI 1 tomorrow. The Impact Accelerator Awards were something that I hope people are aware of. This is, again, funding that we have, which is a completely open call. You can come to us at any time for this. And they're around about 25k per project. And these are for things where projects are coming to an end or have come to an end, but there's something emerged from that project where you might think, actually, with a bit more money, we can create more impact. We can do something with something, we've identified something. So often we think about, we all think about impact right from the beginning, but some things appear as the project evolves and develops, and we get our findings where we think, actually, with just that little bit more, we could do so much more. So that's what our Impact Accelerator Awards are for, and so far we've invested 350k in those. We've funded 15 projects. So if you've got something here and you've got some ideas, talk to Michelle. Michelle, could you just wave? So Michelle Wilson-Chalmers is our new knowledge broker. She's been in post 2 months. Some of you will have met Katie Appleby in the past. Michelle is new in post, comes with loads of experience, and is here wanting to talk to people. So if you've got ideas about how creating impact, there's money and also expertise to help you. Also this time, something that's new, which you're going to hear about tomorrow, is our Voices programme. and that's voluntary sector evaluation scheme, which is what's there. Now, some of you will recall that we had a program called FES, which was the Public Health Practitioner Evaluation Scheme, where we invested funding in terms of ideas coming from our partners in local authority, and we worked with them. I know many of you were involved in those FES projects, and we did some evaluation of that in between phase 1 and phase 2 of the school, and developed that. Now, that FES programme was the basis and the inspiration behind FIRST, and I know many of us are involved in FIRST, the Public Health Intervention Responsive Study Teams, which is why we call it FIRST, and there are 8 of those now, with another 2 to come on board. So there's a huge investment in that area now. So that was something that really didn't need us, because what we could do within that compared to the investment in FIRST would have been very small. So FIRST is only open to local authorities. It's not open to voluntary sector. So we're doing some work with the People's Health Trust now, and so that this is about engaging with the voluntary sector in terms of doing evaluation of work that has been led by the voluntary sector as opposed to by local authorities. So you'll hear a lot more about this tomorrow. But within this, we've partnered with the People's Health Trust because this is new, and that area of charities and governance around charities and so forth is something that we need to learn about. So that's why we're really grateful to the People's Health Trust, who's been working with us, and you'll hear much more about that. Some of you, certainly at ResNet, saw this slide yesterday. And this is quite a complicated slide, and I'm not going to go through everything on this because I only have 2 minutes and 5 seconds left. But this is our academic research capacity development and training. And this is led by Rhona, and all of us are involved in this, and many of you are part of this. And this goes right from summer internships. And I'm minded to the lightning talk we heard this morning about work, and also thinking about how we increase inclusion in that. Now, our summer internships are for undergraduates, but we know many of our undergraduates work in the summer and might be doing bar jobs or cafe jobs or whatever. Our summer internships allow us to have undergraduates come and work within the school, often supervised by PhD students or by research fellows, who then get the experience of the supervising, but also we have paid summer internships, which hopefully, and we know it does, inspire some people to have a career in public health or public health research. So we've had interns who've then gone on to master's programs funded through the mental health program and others, and many other stories of success. So we've got blogs from them on our website. Pre-doctoral fellowships, so post-masters, pre-doctoral, PhD studentships, launching fellows, so immediately postdoc, 2 years funding to get people to consolidate and gain more research to be ready for that next stage. The ResNet funding, that's for people who've never been a PI before, never led a project, to work in collaboration with other people across the school and to have their own project. And again, there'll be many of you here who've had ResNet awards, and we put more funding into that this time round. So we funded 18 ResNet awards in this phase of the school. Transdisciplinary placements and fellowships, and we have some of our transdisciplinary fellows here. These are people who do work really, really relevant to public health, but didn't necessarily think of themselves as being in public health research or practice in the past. So that's really exciting. And then new that we just got additional funding for is we have our own phase of the pre-application support fund, which is for people to apply for time out to be able to write fellowship applications. So a real range of funding there. So you're going to be hearing lightning talks, digital stories, posters from all of these people of the rest of today. You've already heard from some, you're going to hear from more. So my time is up, and I'm just going to say thank you. And all of that is what you are all doing. So, thank you to all of you to making sure that all of that, the research programs and all of the capacity building is working. and that I know there's a massive investment from everybody. So I'm now going to introduce Healthy Places, Healthy Planets. So that's one of those 4 programs. So I'm delighted. I think I'm inviting both Matt Egan and Frank, no, just Matt. And Matt up to the stage to tell you about this program. So thank you, Matt.
Yes, so I'm Matt. I co-lead Healthy Places, Healthy Planet with Frank, and our program team involves Katrina, Morella, and Rachel. And lots of people are involved in the program through the projects, including people from research, policy practice, and members of the public too. So a big thank you to everyone. I'm going to give a quick overview of the program and then pass on to 2 of our projects so they can just talk in a little bit more detail about what those 2 projects are doing at the moment. Okay? So our program aim is written formally on the screen. Basically, we are, as our name suggests, we're interested in health and place, and we're interested in environmental sustainability and taking action to help with the climate crisis and some of its effects on people. We have a strong interest in health equity, and we have a strong interest in trying to evaluate ways in which we can improve things, ways we can take action to deal with these challenges associated with making places healthier and dealing with environmental sustainability and the climate crisis. I'm going to give you just a little tour around some of the projects that we do. It's worth pointing out that some of our projects lean towards health and place. Some of them lean more towards the sort of Healthy Planet side. All of them speak to all sides of that. It's just that some feature kind of a one pole and some lean towards the other. On the Healthy Places side, we've got an interest in the commercial determinants of health and things that to do with the commercial sector which affect people's health and affect health equity. This slide shows you the first round of Healthy Places, Healthy Planet projects. So these are the ones that are kind of fairly well underway or near completion. Our first one was a look at the nighttime economy and looking to see how local authorities take action to deal with the health equity issues around the nighttime economy. For those who are unfamiliar with the phrase, the nighttime economy is basically, well, in our study at least, it's the things that you encounter when you go out for a night out. We've also got a project on advertising, so particularly advertising unhealthy products, as symbolized by a bus stop with an advert for a hamburger on it. We previously, in a previous 5-year cycle of School for Public Health Research, colleagues had done some research on fast food advertising restrictions in London, and now we've done some research to see how local authorities around the country are in different ways trying to restrict or regulate advertising of unhealthy commodities. We have another project on calorie labelling, which was discussed at the last annual scientific meeting. And now, if we get on to our more sort of solidly, well, all of those are arguably really are relevant to Healthy Planet, but our next 3 were very much sort of badged under the Healthy Planet part of our program. We've got 2 that look at different aspects of transport. One is looking at healthy and sustainable travel, and another one is looking at transport restrictions or traffic calming around schools. And finally, we've got a project that looks at different community-level attempts to sort of mitigate the harms of climate change. So that was our first round of projects. More recently, and actually this one got a bit of a mention in Ashley's previous presentation, we've got a project that looks at ultra-processed food that's up and running, and then we've got 3 more projects which are just going through the sign-off startup phase at the moment, and they are one on climate change adaptations. It's actually a kind of follow-on from one of the stage 1 projects. We've got one on corporate sponsorship of in local government, and one on healthy and sustainable food communities. So they're all starting up. Besides the sort of research projects, we do a number of other things to encourage a supportive network of researchers and other involved people. So we are putting together a couple of workshops. We've got one coming up very soon on economics and equity, which is going to be on the 2nd of June at the London School. And if anyone's interested in economics and equity, then I suggest you send me an email, and I can get back to you on that. We've got another Healthy Places, Healthy Planet meeting planned in September as well, a face-to-face meeting. So all of those people involved in Healthy Places, Healthy Planet, again, we'd encourage you to get in touch with us and learn about that meeting and sign up for it in September. We have Rachel Proctor, who at Exeter leads our programme level public involvement work, and all the projects also have their own sort of project level public involvement. And Frank is a lead on the SPHR network for the use of natural experiments in public health, so that's kind of a methodological network that helps promote and support natural experiment research. That's me, basically. That's to sum up. We now have, let's have a see, Katie and Sima, who are going to talk about the nighttime economy, and then Chloe, Catherine, and Christina, who are going to talk about coastal transport. You realise I wrote those on my hand. It was all the names beginning with C were just confusing me, no end. So. C, okay. Katie and Sima? Thank you.
Hello, everyone. Thank you for the chance to talk about our project. It might be that we were the only volunteers, I don't know, but we're very happy to be here. So Sima and I are going to take you through our project on the nighttime economy. And our focus today will be our literature review, which was about supporting responses to gambling harms that focus on collective explanations. We've got a big team I want to acknowledge, spread across the London School of Hygiene and Bristol and Sheffield. But I particularly wanted to flag up the work of Elizabeth McGill and Laura Fenton, who contributed to the review, and Abby, apologies, Abby Steveley as well. So Sima is going to take you through our broader team because this was a very collaborative project. So I'll hand over to Sima.
So as you can see on the slide, we've captured a few sort of news headlines and also one of the industry level messages, and much of the UK sort of mainstream media focus, as well as that kind of industry focus, is very much on individual behaviours and that idea of so-called problem gamblers. It's the idea that it's an individual's responsibility to gamble responsibility, but also to know what that means, so they're able to identify that and know when their gambling is a problem. A lot of the industry endorsed and funded interventions tend to focus on this key message. And then there's also been a large investment in sort of things like helplines as well, which again focus on this idea of problematic gamblers. Here's some support for you. This has been followed by the NICE guidance from 2025, which again talks about gambling-related harms and puts emphasis on brief interventions and group CBT. But we know that the harms extend beyond the individual. It's not just that individual who's experiencing that. The harms of problematic gambling can affect wider social networks and also across communities. And that makes it much more difficult when we look at that wider picture. And as we start to consider the evidence, we see that gambling causes more harm to health in economically disadvantaged places in the UK, despite that lower level of participation. So this idea of it being individuals and sort of an equal level of harm clearly isn't true. So this slide summarises some of what I've just mentioned and tries to illustrate how the focus of the research was sort of centred and the background to it. So as we can see, the evidence suggests gambling causes more harm in disadvantaged places. And this idea of individual problem framing dominates much of that discourse. And the interventions then also focus on individuals. So as we take that sort of wider lens, what can we actually do to support focus on the social explanations of that unequal harm? If we start to recognise that there is unequal harm, how do we explain it? How do we get people to understand that it's not as simple as some people gamble more, it's their responsibility? So the aim of this research was to co-produce a framework to try and explain how unequal gambling harms develop. And it included two different approaches. So one of those was to synthesise explanations in the literature, and Katie will explain more of those in a little while, as well as also look at stakeholders who are working in the field and bring in their perspectives and views as well through a series of mapping workshops. So this slide sums up some of the activities that were carried out in that sort of stakeholder collaboration piece, and also thinks about some of the things that were achieved. So in total, 58 people were recruited across different geographical regions of England. That included people from the NHS, from voluntary sector organisations, from local authorities, and doing different roles. So whether that was more around public health, whether it was about enforcement, community safety, so all bringing different perspectives and views. They all had a role working to reduce inequalities from unhealthy commodity industries in England, with that focus around the nighttime economy. And through sort of further work and development, the focus on gambling sort of emerged from that. The intention was to sort of develop a collaborative learning environment, and that was known as the National Learning Partnership for this project. And through that National Learning Partnership, a number of activities were conducted. And within these activities, we were able to sort of develop the focus around the project being gambling and alcohol and the impact of that. The partnership was able to support the review of the literature, so really think about what things were important and sort of set the scope of that review. We also looked at identifying two key locations as the field sites. So Derby and Swindon were used as areas for a bit more of a deep dive focus of how do things sort of actually play out in practice, what's happening in these local areas, what does it look like, what sort of is the demographics of that area, how are these sort of products available and impacting upon people. And then there was also a number of sort of the mapping workshops where this work took place, and again the partnership was involved in designing some of those pieces of work as well.
Okay. So I'll talk you through very briefly our scoping review and theory synthesis, which is just to say that what we wanted to do was identify the range of explanations for unequal harms from gambling and bring them together in a useful way. So we sought explanations, we sought the richest explanations we could find that were focused on collective explanations, looking at groups of people. And we included papers on any form of gambling and ended up with 52 papers relating to high-income countries. And the papers ended up touching on online gambling, casinos, betting shops, electronic gaming machines, horse racing, lotteries, and bingo. So we extracted and categorised those explanations for unequal harms. And we found and adapted a framework that offered a good fit for the explanations we were finding in the literature. And this helped us to describe 3 sets of explanations and how they were related. So we'll illustrate each to give you a flavour of the literature. But to summarise here, at the top of our 3-point framework, people's identities and expectations affect how they engage in gambling, including how they plug into gambling atmospheres on the left-hand side there. And these atmospheres that are continually recreated by industry, gamblers themselves, and other stakeholders. And both of these things simultaneously reflect and influence levels of collective control that different communities have in different places. And each of these influences the meanings of gambling in particular places and the resources that people have to prevent and manage harms, that point in the middle of our triangle. So, in the first category of explanations, theories described how past and ongoing experiences influence how people gamble and their capacity to deal with harms. And two pathways were described. Firstly, gambling as a source of identity that could be because of poverty, bereavement, migration and discrimination, which was described as very often leading to social isolation and loneliness. And when people used gambling in this way, they were considered more likely to experience harmful gambling as normal and to neglect other potentially valuable social networks outside of gambling circles. The second pathway described was through gambling for financial motivation, which might be because of poverty, precarious income, or a sense of inequality. And the processes described here were increased susceptibility to the cognitive fallacy of a big win, and people were more likely to gamble to recoup losses when gambling in this way. So turning to the second set of explanations, what do we mean by atmospheres? Well, gambling practices are made up of rituals involving people and material things like lighting, buildings, machinery. But how these atmospheres are experienced is unequal. So the combinations of material things and people in different places vary across different parts of the country in terms of the density of outlets, the arrangement of buildings and venues, the number of opportunities advertised for gambling and so forth. And we know that electronic gaming machines are designed to produce overuse and a loss of control by blocking other sensory input. But strategic design also extends to casinos, high street betting shops, websites and apps. And what was described in the literature was the way in which the embedding of these gambling opportunities and these strategically designed atmospheres, the risk can be masked by embedding these and exposing people to these in everyday routine settings. So electronic gaming machines in restaurants, lottery outlets passed regularly in shopping centres. And some people connect or plug into these gambling atmospheres differently because they are targeted. So the literature talks about low-cost familiar food being used to target migrant populations, welcoming spaces being created for women in bingo halls, and peer rivalry being encouraged in online sports betting among young men. Lastly, I want to talk about the category of explanations relating to collective control. And these explanations highlight differences in group levels of control over both gambling atmospheres and public discourses about gambling. So in terms of control over local decision-making, gambling operators find it easier to set up in areas with low social capital because the communities live there are less likely to organise against their presence. And in the UK and elsewhere, the licensing of casinos has been framed as a linchpin for regeneration in economically disadvantaged districts. In terms of the control over discourses, there were several studies that talk about responses to greater gambling harms that focus on individual pathologising, causes further harm through stigmatisation. So I'm just going to ask Simon to briefly summarise the usefulness of this framework.
Okay. So the framework shows that it's inadequate to simply limit the idea of sort of vulnerable people's exposure to gambling. Essentially, we need to consider the integrated processes through which those harms are continually being created. So essentially, everyone can be vulnerable to harm at certain points and in certain contexts. And this, of course, then has implications for interventions. So not focusing interventions on people we would typically see as being those that are at most vulnerable or at risk of harm. And this sort of has broader implications then also when we think about how we manage that broader risk. So the licensing objectives within the Gambling Act state that children and other vulnerable persons should be protected from being harmed or exploited by gambling. However, when vulnerability is invisible, how do we actually apply that? How do we say this is a protection that's being put into place? As Katie talked about, it's really important to explore those meanings of gambling in particular places and how people are engaging with that atmosphere that's being purposely created. There's some guidance from the Gambling Commission for local authorities around managing those issues and actually understanding those local issues, but it can be very challenging to actually apply that. So as Katie said, how much influence do people actually have locally about what happens in terms of gambling? Local authorities face significant challenge, so the idea around gambling is that it's a permissive legislation, so essentially should be applied, local authorities should aim to permit premises for gambling wherever it's possible. So refusal is incredibly challenging. There has been a local case recently in Sheffield where the local authority refused a grant and it was appealed, and the judgment around that brought some really interesting points around how do you actually refuse, what are the important points. And some of the things that came out really strongly were around those local area risk profiles. So what is unique about that local area? What are the challenges and risks? And that gives that opportunity for the framework to be applied. How do we understand what's happening in this local place to create a risk profile and potentially challenge or refuse permits for gambling where the idea would be to prove otherwise? And that brings us to an end.
Hi everyone, welcome to our presentation. We're going to be talking about the Evaluating Rural and Coastal Communities Active and Sustainable Travel Project, or COAST. I'm Chloe, and today I've got with me Catherine Jacobs from South Gloucestershire Council, who will talk a little bit more about her time on the project, and also Christina, who will talk at the end as well. But our project is a wider team. It's not just us three. There's many more people, both in the audience and kind of here in the room virtually with us and in spirit, people from kind of local councils, participants that we've engaged with, and also our partners such as Sustrans and the East Durham Trust, for example. So today I'm going to kind of update you on where we are on the project. Last year we spoke at the ASM and we really presented what we were going to do. We were very excited. There was a lot of things, there was a lot of milestones we were going to achieve, and I'm pleased to say that we have kind of completed work package 1, which is really great, and we've produced a paper which was published last week or the week before, so really recent. But you can scan the QR code and get the online first version here, and that paper is talking a lot about some of the kind of friction points and challenges, but also opportunities in the production and implementation of policies relating to active and sustainable travel in rural areas across the southwest and northeast. So just to kind of update you again on what we did, we kind of executed what we set out to do, which was a kind of wide document analysis of national and local documents that aim to kind of identify key policies and both nationally and locally. We also undertook interviews with stakeholders across the southwest and northeast to identify some of those challenges that were happening on the ground, and also recent action to do with schemes such as the 20 is plenty mile-an-hour speed limit rollout across the southwest. Finally, we undertook systems mapping workshops with a group of stakeholders to really start to think about the wider system and share solutions across partners. So some of our findings, but you can read more about these in the paper, and I really recommend going there because it fleshes it out much more brilliantly than I have the time here today. So first of all, kind of scarcity in terms of a lack of kind of policy attention on rural areas, but also decades-long resource issues has created a context where many people working in this area, in rural areas, feel they're really up against it and they're forced to kind of do more with less. The second point is around kind of volatility. So the literature in this area has really described a kind of frenetic policy context where transport teams were required to do more with less, as I've said again, to do with the scarcity. And finally, contestation arises out of these conditions where local communities are backlashing against schemes, which are then emboldened by frenetic political U-turns, such as the Plan for Drivers document that came out not that long ago. This is the CLD, the causal loop diagram we created from the workshops we did with the partners. Again, please scan the link to go to the Kumu for a presentation. I don't have time to explain it more here, but really that maps the kind of general system and showcases some kind of conundrums we had. And the final QR code, 3 QR codes in 3 minutes, 1 per minute, this is great. The final QR code is the creative approaches to public health research seminar series that we undertook. And Christina will talk a little bit more about our creative approaches to research at the end. But thank you, I'll hand over to Catherine.
Thanks, Chloe. Sorry. So, hi everyone, I'm Catherine Jacobs. I work for South Gloucestershire Council. So, for those of you who don't know, that's the authority that's immediately north of Bristol. And I was able to support this research project for a short period of time through my NIHR local authority short placement award for research collaboration. So quite a mouthful, LA Spark for short. And my placement ran from June to December last year, and over that time I was able to assist the team with their stakeholder workshops that was delivered as part of the Work Package 1. And I was able to provide a bit of an informal local authority perspective on the research findings and a bit of an informal sort of sense-checking role. I was also able to connect the COAST team to our senior managers at SGC, that represented transport policy, planning and projects, and they as well gave some informal feedback and their perspective on their findings. And towards the end of the placement, I also delivered a dissemination plan. That's from a local authority perspective. So I listed out sort of community groups and organisations that I thought would find the research useful, but also that would help with the dissemination. And then sort of try to give a few ideas to the research team on how they can change their research delivery, I guess, to suit the audiences within local authority. So presentations for council members and more technical documents for council officers, for example. So I really enjoyed my placement. It gave me a real insight into research practice, particularly with the stakeholder workshops. I got new skills with systems mapping and Kumu, and I've taken those back to South Gloss. As part of my practitioner role, I was able to develop new networks and connections, which was really great, that's outside of the local authority area. And it's inspired me to have a little change in direction in my career, to sort of look at more about research. And possibly most important, I made lots of new friends as well, which is great. Next step, so yeah, I'm inspired to continue a practitioner researcher role and continue to build on the connections that I've made. And I managed to apply for the NIHR Pre-Doc Award, so fingers crossed until June when the results come out. But regardless of what happens, it was a really, really valuable experience, and I've learned so much from the process. Thank you.
Yeah, so last but not least, having moved on from our policy focus, we're now in the middle of Work Package 2, where we look at people's experiences in County Durham and in Cornwall, how they get around and what challenges they face when they want to undertake active travel. And for this work, we're using a mixture of qualitative and creative methods, and I want to introduce you to those methods and talk a bit about why we chose them and what kind of results we are getting using them. So as you can see, we have quite a large portfolio of methods that we're using and that are very flexible, so we adapt them to what participants want to do as well. We've done a range of unstructured interviews. We've gone along with people on walks and interviewed them as part of that. We've done mapping interviews and photo elicitation to look at people's routes and experiences. And we've also done participant observation and autoethnography, for instance, when joining on walking groups, but also on the bus travel that we undertook ourselves, using photography, soundscapes, and videos to document our experiences. We've also got some creative group workshops coming up that we're very excited about. So why these methods? We really want to get at a wide range of experiences that people make, and we want to look at the embeddedness of active travel in everyday life, which is quite complex. So we want to work on all these relationships that it has to different areas of life. We want to look at embodied and effective knowledge and reflect on what might usually go unnoticed because people just think it's normal and it's their habit. But also we had to find ways to engage participants in over-researched communities where there's a bit of research fatigue as well. So what kind of results do we get? I recently presented a conference paper based on some of the initial findings on comfort and discomfort. And that work, which we're now looking at writing up, really challenges the idea that people choose to use cars because that's the most comfortable option for them. So we find that actually for some people, car travel is not very comfortable, be that because it clashes with their values or because cars are just not built to accommodate the kinds of bodies they live in. And for them, active travel can be the comfortable option, it can be their comfort zone. But then on the other hand, and this is talking about people who are able to access these modes of travel in the first place, they still have quite unequal amounts of work to do to keep the level of discomfort that comes with moving about at bay. So here's an example from a man who I took a bus journey with who told me about how he manages being overwhelmed when he takes the bus because he has a hearing aid that struggles to filter out background noise. So he usually grabs a paper, shields himself off from the rest of the bus, turns off the hearing aid, and that way is able to manage that journey and keep the discomfort at bay. Yeah, so these are some of the results that we're getting at the moment, and many thanks for your attention, and we're really looking forward to your questions.
Okay, so thanks very much for those very exciting presentations. We'll now take questions both in the room and on Slido for both of our presenters. So any questions from the audience? Over here. Oh, thanks.
Hi, thank you. It was very interesting talks. I have a question. I'm sorry, I don't remember your name, the people that talked about gambling. I was wondering, in your opinion, do you think there should be like a national ban on gambling like in other countries, or what are your recommendations or suggestions?
Thanks for your question. I think many people are arguing for much stronger legislation at a national level, and I definitely think that's needed. I think what our project was an attempt to do was to change the narrative, as we spoke about, and encourage people to think about what can be done locally to change the narrative. And Simon's example about what happened in Sheffield with the refusal of an application based on vulnerability in terms of place and partly public health, which is quite unusual. Our project was thinking about how we can support action at a local level where people are making the case about future anticipated harms to people in places. But I do think, as most people are saying in public health, that much tighter regulation is needed around advertising and the way online gambling happens.
Thank you, Katie. Next question from the room.
Thanks so much. Something on gambling also. I don't know, because when Matt was presenting about the program of work, he mentioned something around advertising and unhealthy food. And when you think about gambling, one of the things I've seen very fascinating is if you look at the number of the miles you walk within every city, especially those of us that live in, depending on where you live, you can count, I've done it before, the number of alcohol joints and gambling sites or gambling advertisements. I don't know if you're thinking about doing something like this, because sometimes when you present some of these evidences, policymakers see it as more of out of sentiment. But if we can do something like a mapping of maybe gambling advertisement distribution and what is the impact in terms of the outcomes, what people see on TV, what you see on your phone, what you see on billboards everywhere is this. So it sticks to the brain. So even when you try to put in policies, so are you thinking of doing something around gambling advertisement as well and the impact?
So I don't know if Matt can answer about some of the other work that might be planned.
Thank you. Sorry, I realize I'm talking. I'll sit like this. So we are doing research around that. And one of the other projects in the program, we're looking at advertisement policies more broadly, and that includes gambling. And one of the bits of that project also aligned with work we do outside of the School for Public Health Research, is going to be exactly that, a walkthrough kind of survey and see what advertisement is there and what do people get exposed to.
Okay, thank you. So online we have one comment and one question. Comment, everything I've heard today has been incredibly useful and the potential is great, so positive feedback. A question for the Transport Squad. So sorry, I know that's not your official name.
So funny.
A question for the Transport Squad. So Coast Work Package 2 creative methods are really interesting. How do you factor in more varied or creative approaches in a structured budget or time frame?
Do you want to start or should I start?
Yeah, go ahead, yeah.
Well, it's definitely a challenge, especially working with communities where there is a bit of healthy skepticism around engaging with researchers. I think we've got quite good project planning from the outset, so we've got an entire year for work package 2. I just came in for that year, so I think the additional challenge of kind of setting up the relationships before actually going into that work. But I think just sustained engagement going out to these communities has been really helpful to just be present and be seen around there and answer questions. But we've also had fantastic practice partners, so local organizations and charities that have been able to really speed up that process and link us to the kind of communities that we want to talk to.
Yeah, and also on that, kind of being really flexible and adaptable to participants' capacities, capabilities, and interest in the methods as well. Some of the people that I've worked with don't want to engage in the creative things, so we go down a kind of more traditional qualitative route. So it's really about being open to the possibility of creative and non-creative, and actually creative processes don't necessarily require a lot of resources, particularly the things that we've been doing, using people's knowledges already around their devices or cameras and that kind of thing, rather than necessarily getting them to learn anything new, because there isn't really capacity in the project to be doing that for this project. But in the future, that could definitely be something that would be good to do if it was more kind of participatory in that vein, setting up co-researchers.
Okay, thanks very much. Question in the front row.
Thank you, JJ. Thank you for great presentations. I guess it's a question for both of you, both groups, the Transport Squad and the gambling group. When we talk to people in local authorities, and Catherine might speak to this, and also particularly elected members, what they like is local stories about local people and the stories that they can tell and how powerful they can be. And I'm just thinking about the transport work and the when you're doing your go-alongs or talking to people, and also thinking about the gambling work. Are you going to be able to extract sort of personal level local stories which you can use to illustrate some of the findings and also to help generate some of that impact, make it meaningful in a local setting?
Yeah.
So Transport Squad, please answer first, and then we'll hand it over to the gambling ring.
Great, Transport Squad. Yes, I think definitely with the creative workshops that we have planned in the summer and beyond, those will be the opportunities to really tell those stories that are really important to people's everyday lives and capture that in a kind of creative way. There's also some really cool artist practice work going on in the Southwest. An artist called Tash Pavey, who's just released a film about bus transport in the Southwest. So looking to creative practitioners also that are already doing this work is an important thing that we need to do, and bringing those voices in because they can tell
different stories or stories that are kind of maybe more politically focused, that we can then support them in that work as well, because they're often working freelance.
I'll just add something in relation to gambling about the other part of our project that we said less about, which was focused on depicting in visual maps what inequalities in harm look like in 2 localities in England. And with our collaborators, the group that Simon described, we worked hard to think about what sort of areas in England would be useful as case studies. We had collaborators all across England, a lot in local government, and we asked them about what they'd want to see when they were looking at case studies of other areas, what would be useful. And we've developed a project website that shows those visual maps with a lot of the data behind it. And that is, I think, where we're attempting to connect our framework to what's happening in local places through stories.
Okay, thank you, Katie. So last question from the internet, and it actually has come in with question for the Transport Squad. That's how it begins. It's catching on. Can you tell us a bit about applying for ethics for not just one creative approach, but a portfolio of creative approaches? Answers on the back of a postcard.
So we were quite strategic with the way that we applied for ethics. Before Laura left the project, she supported us to apply for ethics through the Durham Anthropology Ethics Department, which allowed us to kind of explore. Which allowed us to kind of explore. They were more well versed in terms of the kind of creative approaches, which they definitely supported us to get the ethics clearance in a way that maybe it would have been more challenging under the medical school in Exeter.
Very diplomatic. Okay, round of applause for our panel. Thank you. Okay, we're now going to head into a round of lightning talks. So as usual, we're not going to pause between presentations. Polite reminder, since we're having a hard time following instructions, that we're not doing applause between each lightning talk. But you will have the chance to applaud them audibly at the end of that sequence. Okay, so Rhiannon Thompson, Lizzy Winstone, Davara Bennett, Jennie Parnham, Patricia Albers, thanks very much for presenting. Over to Rhiannon.
Thank you. Hi, I'm Rhiannon. I've been asked to talk just for a few minutes about my postdoc launching fellowship journey. So the idea behind the scheme is that you kind of have a bit of extra time for things like writing and grant applications and to, set up your next steps. So I spent quite a lot of time in my first year writing papers that I had from my PhD. I also took part in the NHR Incubator for Mental Health Research Grow programme, which was really great, involved networking, workshops, a bit of coaching as well. And I met some other early career researchers interested in mixed methods. We wrote a reflective piece about that as well. I also applied for funding, so I received a couple of grants. One was an SPHR ResNet Award, which is for a project called Environmental Action, which is about mental health and environmental activists and volunteers. And there's a picture here of me and Esther Curtin with a couple of the activists we've been working with. I received was on another grant which we received as well from Rose Trees Trust, which is something called the SCAMP Research Challenge, which is kind of a PPIE type program in schools where we work with students to co-produce research projects and now a social media mental health intervention. I've also been rejected from a few grants and a few journals, which I think is important to acknowledge. Years ago at a different SPHR event, Anthony Laverty was talking about this idea of a shadow CV, which is the idea that everyone has this list of things they tried and they didn't succeed at that no one actually sees, which I found a really helpful perspective. I guess another big takeaway for me was just sort of learning and appreciating the process of planning and thinking, whether I got the desired outcome or not. At this GROW program, someone talked about, basically said that if you don't enjoy the process of putting an idea together, you probably won't enjoy doing it, which really stuck with me. I then paused and went on maternity leave, and I will take any excuse to show people my son, so there you go. And now I'm back in my second year, so thinking a bit about grant applications, job applications, next steps. I've had a few publications from that writing I did in my first year, continued with my projects. I did a practice placement I've just come back from at the Ministry of Housing, Communities and Local Governments, it's now called, which was really interesting. I have a lot of reflections about that, which I do not have time for, but feel free to grab me after if you want to ask me about that or about any of my projects as well. Thank you.
I don't have a title slide, but I'm Lizzy Winstone at Bristol, and I'm going to tell you about a fellowship proposal that I'm working on. So we teach children how to cross roads safely and not to talk to strangers, yet we rarely prepare them to positively navigate social media, a space that's just as full of risks and opportunities. According to Ofcom, 93% of 11 to 15-year-olds have a social media profile, with many using apps way before the required minimum age of 13. There are benefits offered by social media in the form of entertainment, distraction, information, social connection, but many young people also report regularly encountering online harms. During my PhD and since, young people have told me about the mental health impact of encountering violent, triggering, racist, sexist, homophobic content, online sexual harassment, cyberbullying, and the everyday pressures of social comparison, feeling judged, and having to constantly be available to their friends online. What if social media literacy, so teaching young people to use social media critically and safely, could promote more positive online experiences, reduce negative ones, and or mitigate their impact on mental health? This is what I want to explore with an advanced fellowship. Young people have told me that they've had to learn how to navigate social media safely through their own experiences and often in response to harmful ones. They say the lessons they receive in school can be unengaging, limited, and repetitive. Teachers are also critical of the curriculum. They often report feeling roped into delivering this without adequate support, training, or resources. They also often don't use the same social media as young people, leaving them with limited understanding of their daily online experiences. I'm proposing an intervention optimisation and pilot feasibility study to improve social media literacy education in UK secondary schools and subsequent mental health outcomes. I want to work with key policy, third sector and public stakeholders, so young people and teachers, to see how current practice in social media literacy education might be improved, drawing on previous research, statutory frameworks and existing resources in the UK and beyond. I'll then conduct a feasibility study with mixed methods process evaluation to explore whether a large-scale study can be done, whether it's worth doing, and if so, how. If the feasibility study shows that the intervention might benefit young people, I'll then run a fully powered trial with more schools to test how much young people's online experiences and mental health improve, and if it's a good use of money. If the intervention's effective, young people will feel more confident to make informed choices, recognise and manage online risks, build resilience in the digital world with better mental health and wellbeing outcomes.
Hello, I'm Davara. My research has been all about how to safely reduce this huge unsustainable rise in children being removed from their family homes in England. As a PhD student, I sometimes felt very small, insignificant, and unequal to the challenge. So one aim of my launching fellowship has been to find fellowship in this space. I kickstarted the launching fellowship with a report on children in care in the north of England. The central photograph is of the parliamentary launch event. Rebecca Pierre is speaking. She's a care experience person from Blackpool, a qualified social worker, writer, activist. She wrote our foreword. She of the fabulous hair is Kirsty. She spoke about her fight to get her daughter back. And to her right is Amy Van Zale, who leads a peer support organization for mums in Newcastle. It's really Kirsty and Amy who got me really interested in the parent advocacy space. So I've just started a placement with Support Not Separation. They offer peer support and advocacy to mums in Camden. They are quite an adversarial organization, very mistrustful of the state, and they have some positions that sometimes conflict or are in tension a little bit with my own, so I think it's really important for me to better understand where they're coming from. So all my work has contributed to the creation of this research development network for children at risk. So on the left are visual minutes from our first workshop, which centered care experience voices. And it has already led to 2 successful NIHR 3 schools application. In my quest to build research capacity, myself and my colleague Latif will be hosting 2 care experience undergraduate interns this summer, and we have some really strong applicants, and I'm really hopeful that, and I expect, that they will be the researchers of the future in the space. Finally, I have been invited to join the steering group of the Child Welfare Inequalities Network. That meant a lot to me. They've been really supportive. Back when I published my very first PhD paper, they reached out to me. They gave me the ECR talk at their inaugural seminar. And last year, I was guest lecturer on a PhD course they ran at the Norwegian University of Science and Technology. So with this fellowship arrayed against child welfare inequalities, I hope we stand a chance. Thanks.
Hello, I'm going to talk to you about how I'm launching my fellowship journey. So to introduce myself properly, my name is Jennie Parnham. I'm a research associate at Imperial College London, where I also did my SPHR funded PhD. So my research interests generally have been in public health nutrition, which has meant that I've spent quite a long time thinking about and evaluating nutrition welfare policies, so Healthy Start vouchers, the quality of school food, and free school meals programs. And I'm really grateful to be awarded this launching fellowship. I'm about 6 months into this 2-year fellowship, and I've got a number of goals along the way. Some feel a bit nearer and some feel a bit further away. In the interest of time, I'll just be talking about some of the things I'm working on right now, which I'm hoping to kind of, launch me into this journey. So firstly, I'm going to be doing a placement with the Food Foundation. For those of you who don't know the Food Foundation, they're a charity which aims to drive policy change to make sure everyone can access healthy and affordable food, and they're really effective at doing that. They've got amazing policy networks, and they're really great at producing really policy relevant and high impact work. So I really hope to learn a lot from them. And as part of this, I've recently contributed to their early years nutrition report that actually came out last week, contributing some work around how the value of the Healthy Start voucher has changed over time. So really looking forward to that. Also, I was awarded a ResNet project to look at the quality of school food across the entire school day. And this came about following on from some of my PhD work, where I just looked at the quality of school food at lunch. And a local practitioner that I was presenting to said, well, what about breakfast? What about breakfast clubs? And I thought, well, yeah, you're right. So I applied for a ResNet project, which I'm going to be, I'm starting an analysis on now. And as part of that, I am running some public involvement. So I've reached out to a local school. I'm going to go in there and run a public involvement session with parents of primary school children, talking about breakfast clubs, and getting their input and involvement in my work. And I guess this is nice graphic of breakfast clubs there for you. And this is just to say, over this 2-year fellowship, I think all the experiences that I've planned along the way, so whether that's the placement, the public involvement, the collaboration that I hope to build, the training I'm going to take, and the research I'm going to conduct, I'm confident will really flow into and strengthen the advanced fellowship application that I intend to make at the end of the 2 years, and hopefully will be successful. So thank you so much for listening.
Hi everyone, I'm Patricia. Anthropocene is a term that originated in the earth sciences and has been widely adopted across academia and the public sphere. It is a catch-all for the era in which humans have become the dominant, driving, shaping force on the environment and the climate. Some of the characterizing features of this era are vast amounts of deforestation, which you can see in the map on the bottom left. Global warming, which you can see in the graph on the bottom right, which basically looks like the Earth is on fire. And widespread air pollution, which is responsible for the depletion of the ozone layer over the Antarctic, which you can see in the graphic on the top. It is believed that humans are the first species in the history of the planet to destroy the planet with the knowledge of doing so. So of course that knowledge gives us the ability to A, change course, and B, ready ourselves for the inevitable impacts, which is where I come in. This is my jigsaw puzzle, where each individual piece looks standalone, but when viewed together they form a cohesive whole. So on the left is me. I'm a quantitative public health researcher with a background in environmental health. Amongst other things, I have experience in heat and health and solar ultraviolet radiation and health. And on the right is where I'm going. So I'm building a body of work and a fellowship application around adaptation to extreme heat in vulnerable groups. In the middle is how I'm getting there with my current work. So the Impact Accelerator Award, for that I co-created some guidance for health professionals to deliver oral health advice to vulnerable groups with young children. Those are some of the same vulnerable groups that are highly susceptible to the effects of air pollution, to the effects of climate change. I'm working on a Healthy Places, Healthy Planet project looking at community-led adaptation to climate change and how that impacts health. The innovation in involvement work is around finding innovative ways of including parents of young children in shaping health research. So who better to advocate for the needs of young children than their parents, carers, or professionals who work with them? I'll be supervising 3 postgraduate students, or I am supervising 3 postgraduate students, all working in the area of climate and health, one of whom will be looking at policy and guidelines for earlier settings to adapt to extreme heat. And in the summer, I'll be hosting a summer intern who'll be looking at the effects of heat on school performance, school attendance, and classroom behavior. So at the heart of all of this, my work and the wider climate change challenge is collaboration. So just like with my puzzle, where the whole is greater than the sum of its parts, the same can be said for the entire community that is working to mitigate and adapt to climate change, whether that be academics, any other professionals, or the wider public. Thank you.
Good to see we finally held that applause to the end. Okay, so I'm going to invite everyone back on stage, and we'll now take questions from the audience. So are there any questions for our second round of lightning talks from the audience? We have one question online. So Davara, I'm interested on your thoughts on the balance between safety, child rights, and parents' rights in your research.
Yeah, it's a really important one. I guess it's all about how to safely reduce the trends that we're seeing. And I guess when you think about the stakeholders, if you will, whose voices have been least heard, it's also those who most desperately want to safely reduce those trends. So I guess my starting point with the practice placement is that if we're not listening to parents, we are not going to find a solution to the problem. And then those are perennial challenges, balancing those rights, and that's where, you know, the judgment comes in, and finding common ground in terms of what you want to aim for. So I mentioned some of their perspectives being in tension with my own, and I can speak to that further if you're interested. So find me later.
Okay, thank you. Any questions from the audience? Over there, Miranda.
Hi, thanks. They were really interesting. This is a question for Lizzy. Really interesting work and such an important thing to be working on, but I was just wondering about your literacy intervention. You mentioned that obviously teachers are really struggling to know what to do and how to kind of support school students and children, but similarly parents are as well. And I was just wondering if there was any element of a parental element to the intervention that you're going to be piloting.
Yeah, so the intervention that I have in mind is something that was developed by researchers at Cornell University in the States, and it's a really cool it's actually a simulated social media environment, so it's a really interactive tool with these a series of modules with end of unit assessments for the students to do at school, but it also has a package for parents so that students can take it home and have those conversations with parents as well. But yeah, I think parents are often a neglected part of the puzzle, so it's something that I should think about further, definitely.
Thanks very much. Okay, a question online for Patricia, because it's about heat exposure. So you mentioned focusing on vulnerable groups. Can you tell us some examples of the groups that you were thinking of?
Oh yeah, sorry, I probably forgot to mention that. Some of the vulnerable groups would be young children, so children under 5. They're highly susceptible to the effects of heat. Other vulnerable groups would be minoritized communities and communities in deprivation.
Okay, thanks very much. Any other questions from the floor? All the way in the back. Thank you, Katie, for sprinting. Okay.
Thank you all to the panelists, all very interesting. My question is for Patricia. She introduced, the introduction slide was about the Anthropocene. This has been obviously critiqued by various social scientists for the claim that it was humans that did it, when the data shows it was particular groups of humans that did it, i.e. the rich and powerful. And this bleeds into adaptation. Who should pay? And this is an ongoing question. So does her work address this kind of question in any way?
Does your work address that question in any way?
Not really. My work is more around supporting people to adapt. So it would be the people that are most likely to be left behind in adaptation solutions. So like those in deprivation, maybe can't afford air conditioning, which I guess is obviously counterproductive, but yeah, I hope I'm answering your question.
Okay, I think that's all the time that we have for questions. So another round of applause for our excellent panel.